Wellness Wednesday. Our health experts are joining us to answer your specific health and wellness issues. Please welcome back CoolSculpting technician Robert Bowley from Mill Creek Skin and Laser Center, Dr. Mark Shelley from Sound Pain Solutions, and Dr. Joyce Johnson from Weber Naturals. All right, there's no problem we can't solve today. Okay, Robert, first of all, we talked about CoolSculpting. How cold does it get, and is frostbite ever an option? Is it sitting on your skin?
Yeah, and that's we explained to one of the audience members that there's a gel pad that goes on there, and it's actually more of an extraction of the heat away from your body. And it would require much colder temperatures and for a lot longer time. So it's millions of dollars on research and testing, just beyond on the time and temperature equals a result. So no, it's not even close.
It's going to feel cold, but what a result, right?
Yeah, it goes
Not
pretty
too
quick.
cold.
You don't even really feel the cold.
Yeah, you said 25, 35 minutes, not too bad.
Yeah,
So.
and the cold you actually only feel for maybe 2 minutes, and then it kind of goes numb after that. And
Okay.
you just kind of wait it out at that point.
And we were talking about tattoo removal earlier. What are you seeing, and what's actually possible?
Freeing up real estates. People run out of room, and they need a new tattoo. And so, but what's really important is in between there is a combination of treatments, because you're actually scarring the tissue. So you want to do a combination of treating it for scar as you're removing the tattoo. So that's really important.
And coming in for a consultation so you can look at the ink and how much real estate you're
Inks are
trying
not
to free
FDA
it.
regulated, so there is a lot of stuff kind of in between that goes along with that. So we do a lot of testing before we actually will jump full bore into removing a tattoo, which is really important.
All right, thank you. Dr. Shelley, we talked about the way to relieve pressure and using that inversion therapy. And but now what? Once we step off the table, what's step 2?
Then what? Great. So that first stage, I'll go back to my favorite model. We said if there's a disc bulge that's putting pressure into the nerve, we're going to use non-surgical decompression, actually not inversion, but decompression.
Okay, decompression.
So we're talking a $500 inversion table versus a $75,000 decompression table. Big difference in technology.
That, yeah,
so
decompression
we
first.
decompress, we
Okay.
get the pressure and inflammation down, we reduce the pain. When a patient has 30–50% reduction in pain, then we shift into active therapies. We need to address what created the disc problem in the first place. That's normally mechanics. By mechanics, I mean their posture, their movement patterns.
How you bend.
How you bend, how you move, how you spend your day posturally. So we're retraining using exercises, using stretches. The third stage, crucial also, once we've reduced the pain, we've corrected the mechanics, then we have to work to restore strength, stability, and balance. So that's using physical rehabilitation procedures. So it's really that comprehensive approach. If you will, that's the uniqueness to Sound Pain Solutions and why we incorporate all those different procedures.
And you're not leaving us on any of that. You're not just doing 1 and 2.
No.
You're staying with us all
No.
week.
And our goal, we want to get a person out of pain as quickly as possible. We want them to be able to regain as much capacity, to be able to do life as close to normal as they possibly can, and then to have long-term, to have lasting results. That's I got a hug from a patient yesterday, Doug, who came and said, I was just passing by, I had to stop and thank you, because he had 2 previous surgeries, he was scheduled for a third, and because of the treatment he didn't have to.
You've given him new life,
Yeah.
really. Dr. Johnson, eating clean and healthy, as we talked about, that can be a little bit inconvenient. It can take a lot of time, but you say you can do it.
Yeah, it's definitely doable. I mean, cooking and eating healthily is time consuming, but it's developing maybe some more culinary skills, a little bit more of a love and appreciation for your food. That is one of the big steps. But like I was telling the audience during our little break, is that a lot of the grocery stores have become maybe offering some more conveniences to healthy food, as opposed to what we saw even 5 years ago. You can get spiralized zucchini if you want to use zucchini instead of pasta, for instance, right? You can get riced cauliflower instead of getting the cauliflower home and ricing it yourself and shredding it. So there have been a little bit more conveniences. I really recommend food prep. Taking a day where you're prepping your meals for the week, especially if you're really busy and you don't have that time or that luxury to be able to cook a home-cooked meal every day. I'm the mother of, I have 3 little girls, and we're pretty busy. We spend a lot of time in figure skating arenas, so I do a lot of cooking, but having that meal prepped is probably key to staying on track. And it is doable, but
Right.
gaining an appreciation
takes-
for your food, I think, is another step in the right direction.
And Dr. Shelley, technology in our spines, what are you seeing
Yeah. So
as we're hunching?
as we're hunching, as we have the cell phone that's
We
here.
also set up.
Yeah, it's like
Yeah.
we were talking about. It's like my daughter. She's here. It's like, Grace, no, sit up straight.
We need to be mindful.
we're creating. Let's use another prop. When our posture is off, when we're looking at the cell phone, we're creating strain on the discs, and that causes degeneration. That will cause arthritic development. It can cause disc herniation, ultimately lead to fusion. It's creating enormous problems, and we're going to see the fallout 20 years from now.
All right. And that's an easy fix.
It's not easy, but it can be done,
we
and
can-
it's that mindfulness of working to have correct posture, doing things to take care of it at this stage, not letting it get here.
All right. Thank you so much. And we'll be back with more New Day after this.